want to do what has some evidence that will bring us some good results for preventive care. But as Jolene said, Medicare will be paying for preventive care. I'm just not sure if it's in 2011 or exactly when it starts, but they will pay for visits to the doctor and for some of the preventive care that is necessary. The insurance companies hopefully will do more promotion of preventive care as well. You can have a choice of an insurance company that pays more for preventive care or less for preventive care. For example, the Medicare Advantage plans that Jolene talked about being cut, and Mike said that they get paid more than traditional Medicare. These are not the supplements, the Medigap. This is the private insurance like Humana, covers all of your Medicare, and they may include Medicare Part D as well. But these Medicare Advantage plans, if it was really cost effective to do preventive care, you'd think that they'd want to do more preventive care. And these were also some of the proposals with these 4 tiers, the bronze, silver, gold, and platinum. These all have a little different amount of payment for what the patients can get. And one of the ways that you can help to reduce the overall cost of health care is to simply give more skin in the game to the patient. For example, when I see a patient with back pain and they want a magnetic resonance scan, if it's free, they're more likely to want that scan. If they have to pay 20%, they simply ask, well, Dr. Kitchell, what is that 20% costing me? And if I tell them it's $2,000, they say, well, do I really need that magnetic scan on my back? So that sort of skin in the game, as I call it, if you have the patients paying more, maybe they won't want to do that. I've heard some extreme examples of that. For example, if you know how much it costs to take care of cancer patients, for example, a patient with terminal cancer, would you rather give them $100,000 and say, choose what you want to do, or would you rather spend the last 2 months of your life in the intensive care unit and getting radiation therapy and chemotherapy every day, or do you want to save the system some money and just go ahead and take a vacation and be with your family? So again, we need to figure out how we want to use our money. And I think Jolene said at the beginning, right now the insurance companies put caps on your lifetime benefit. So if you have a really expensive chronic disease, right now you'd hit a cap if you hit $1 million over 5 years with the insurance company. So again, we want to have some role that the patients play in preventive care. That's the carrots. And the sticks, it would be you have to pay more if you want more treatment. And so those are ways to reduce the cost by preventive care, the correct preventive care that will be cost effective and be effective for the patients. And the sticks, like I say, making people pay more out of their pocket. You've heard about these health savings accounts. That's the extreme. Your business or you could put money in a tax advantaged account. And this is happening a lot in the Twin Cities up in Minnesota. There are people that have $10,000 that they have to pay before their insurance kicks in, so they can use that health savings account for that first $10,000 of care. So they're going to be pretty wise users of health care. So these types of proposals to have more patient involvement in their decisions, whether it's preventive care or this, you've got to pay the first deductible amount or some maximal out-of-pocket cost. Those are ways to put a little bit of damper on unnecessary treatments or ineffective treatments. And as I said, we as physicians and healthcare professionals need to know a little bit more about what are the cost-effective preventive treatments or the cost-effective treatments, because if we're saying to a patient, you got to pay $10,000 out of your pocket, the first question they're going to ask the doctor is, well, is that brand name drug more effective than that generic drug? And if they have some skin in the game, they're going to want to know if paying 5 times as much for the brand name drug or 1/5 as much for the cheaper generic drug, which is the most effective. So again, we need to have more information about cost effectiveness, and we need to have more skin in the game for the patients.
I'm going to add to this a little bit. There is a grant for small businesses that they can apply for that will allow them for up to 5 years to establish wellness programs for their employees, which would be a good thing. Wellmark, Blue Cross Blue Shield down in Des Moines has instigated a program that by October 1st of this fall, that any employee who works for them will not be allowed to smoke either in the workplace or outside the workplace, meaning they cannot even go out to their car to smoke after October 1st, because if they come back in and they smell like smoke, they'll be sent home. So there are some things that are maybe on the horizon that employers will be able to do to encourage their employees to wellness, and stop smoking is probably one of the biggest one that they can really encourage their employees to do.
Jolene, how would people find out about that grant?
It's starting in 2011, so I'm assuming that there will be directives coming from the federal government as to how those will be available. But at this point, I have no data on that.
Just looking at an 88-page summary of the bill, there are tremendous amounts of grants, programs affecting from depression to congestive heart failure, lots of dollars, lots of big zeros in this. So you'll see what Jolene talked about, lots of opportunities, community grants for community health, CDC dollars, National Institute of Health dollars. So there are mega dollars in the bill earmarked for specific areas, something to look for.
Hi, I'm Jan Walter. As we were listening to all of the debate on the bill, the statement kept coming up that if you have an insurance policy that you like, don't worry about it, you'll be able to keep it. My question is, for how long, and will it cost a lot more, or is it a fact that that could happen?
You're correct. I think this is going to affect small businesses more than companies who have 50 or more employees. So we're talking the 2 to 50 market. If your employer is, wants to continue their group insurance, they will be able to do that. But at some point, 2014, when the exchanges are set up, if those rates are more attractive because it's now part of a bigger pool, your employer may decide not to offer the group insurance, and they may say, well, we'll bump your salary to compensate for what it's costing us, but now you will be forced to go to the insurance exchange to get your insurance.
I worry about that, because from a hospital perspective, our payer mix is very important to us, and our commercial-based payers. Again, we talked about the shortfalls for Medicare and Medicaid. So if we see a deterioration, or we see individuals transferring into an exchange, and if it's anything funded like Medicare and Medicaid, that could put a severe harm to our hospitals. So we typically will see about an annual increase of about 3 to 6% from an insurance company, and I'm assuming the physicians in a like manner. So there sometimes are disconnects